Well, welcome to Facebook Live for WWL TV. I'm Katie Moore, and of course, coronavirus is at the top of everyone's minds. And we have a really fantastic doctor who's been with us throughout this whole ordeal, who's been answering your questions, giving you the information that you need in order to maintain your sanity, your survival in some cases, and really get the answers to the questions that you're looking for. So Dr. Benjamin Springgate is joining us here in the WWL TV studios just to take some more questions from you. If you want to send us a question, you can do it in the comments, or you can do it through our new ability to text us. All you have to do is text us at 504-529-4444, and we can try and answer some of your questions. So get them coming to us, and we'll get them answered as soon as we possibly can. But Dr. Springgate has been with us throughout much of this, and he is planning to be with us, hopefully, we hope, as we move into the future. What are you hearing this afternoon as you're out and about and talking to people within the medical community about the state of our ability to handle this?
I know that healthcare providers and first responders are taking this very seriously, that we continue to try to encourage social distancing. We want people to try to stay at home to the extent possible, except for essential services like going to the grocery or the pharmacy, wash hands often, disinfect surfaces. We recognize, based on the governor's comments yesterday and previously, that we are facing a crisis with our healthcare system locally. We are anticipated to hit the maximum number of available beds and ICU beds in a number of our hospitals, perhaps as early as the first week of April. So this is a significant challenge that we all have the opportunity to rise to.
And when we say we've reached the capacity for hospital beds, is there any way to let people understand exactly what that means?
So ideally, we are able to put each patient into a bed where they have the normal, usual access to the same level of service that they might have had last year or the prior year, in terms of personnel, in terms of availability of machines, medications, other needed support. And if we reach capacity, and if there are not additional surgery sources made available to us by the federal government or otherwise, then that means that our ability to provide care potentially decreases, and we're not able to provide the same high level of care that we want. Crisis care is not what we want to be able to provide. We want to be able to provide a consistently high quality level of care throughout all of our area hospitals. And so that's what we're trying to make sure that we can do. I know that the governor is speaking with the federal government to try to ensure that. And so we're going to continue to work towards that and make sure we get the resources that we need.
Now, we heard from the governor that there are nearly 100 people who are on ventilators right now at hospitals across Louisiana who are battling COVID-19. What does that number say to you in terms of what we can handle?
Well, that's a high number, and that suggests that, given that we are not near the peak of where our infections are going to be, and we are not at the peak of where the hospital admissions are going to be, that suggests that we are going to be in for a difficult period of time.
I think that is something that's weighing heavily on a lot of people's minds, and we are starting to get some questions from people as they try to navigate this crisis, and as we all try to navigate this crisis. And one of the ones that we received just now is, can the virus be transmitted to or from cats and dogs?
We do not believe that the virus at this time is likely to actually infect or be contagious to the cats or dogs, but it certainly can get on their fur. And if someone is sick and they are in isolation, the virus can get on the fur. If someone else comes and pets the dog, it can be transmitted to that person. So ideally, you don't want to let your dog run the neighborhood or go out be pet by other people. If you yourself are known to be contagious at this time, you want your dogs or animals to stay inside to the extent possible. Or if it's an outside cat, then let them stay an outside cat, and you don't have as much interaction with them.
I think something that someone else asked me before we came on today is about washing your hair. If you're one of these people who are out and they're grocery store workers or people who are working for the Postal Service or who are interacting with the community, nurses, doctors, etc., should you wash your hair every time you come home? Can the virus be transmitted that way?
Certainly the virus can be transmitted from virtually any surface if someone else is in close enough contact. So I was discussing with one of my friends last night who is a doctor in the Seattle area, and her regimen when she comes home from work in the emergency department is to take a shower, first take off clothes, throw them in the wash, take a shower first thing, wash, and go from there. So I think everything is on the table as far as what we can do to minimize the likelihood of transmission within our own homes or otherwise.
Okay, so those are some good ways to stave that off. People are asking for specifics about how the flu is different from this. When we had, hundreds of people who died from the flu, when we're talking about these hospital beds and we're talking about this situation, why is it different?
In this instance, there's a higher level of mortality or higher death rate associated with this virus. In addition, with the flu, even though the flu is bad and the flu affects many people each year, we have some baseline level of immunity to the various strains of the flu because we have been exposed to the flu previously. This is a novel virus that came from a different species, an animal, to humans just a few months ago. So there is no built-up immunity across the human species. That means that we are highly susceptible and highly vulnerable to this, and that's why it's a crisis.
When we talk about herd immunity, what is herd immunity and how could that play a role here, and will it play a role here at some point?
Yes, it will play a role at some point, and herd immunity basically is this notion that after a period of time, enough people become exposed that the history of being exposed means that people develop immunity, and if a large number of people develop immunity, then that means it makes it less likely that if a new person comes in with the virus that they can spread it to someone who hasn't yet been exposed because they have to be transmitted through multiple other people in order to get to the person who hasn't been exposed. Now, our questions about who becomes immune, are we likely to become immune to this virus or not if we've already been exposed, remain outstanding. We're not certain about that yet. So we're hopeful that we will get some level of immunity to this virus after exposure, but that's still not clear.
So one of the questions is this like the common cold and the flu in which it can mutate and have different strains, which means what?
Eventually, it is possible that this may mutate, as many viruses do. In which case, some viruses mutate and they become harmless, which would be great, and some viruses mutate and they, instead of causing, a sneezing, they cause a cough, or they, instead of taking, 2 days to become symptoms, they take 3 days to become symptoms. There's a variety of different ways that viruses can mutate, so we can't predict what shape that may take, but it's likely that in the course of time, any given virus species will probably mutate.
Okay. Are pregnant people at a higher risk of the virus? I know a lot of people out there are wondering that. I know the science hasn't really caught up to that question yet.
That's correct. And so our obstetrician community, the healthcare providers who take care of pregnant women are certainly watching this very carefully. They are seeking to provide the highest quality care. This is something that, of course, people are going to worry about. We do not have any reason to believe at this time that this is an area that pregnant women specifically have to have greater concern than the average community member, but definitely stay in touch with your obstetrician, with your healthcare providers. Make sure that you are in communication to ask questions and express your concerns.
Someone else texted that they're 32 weeks pregnant, which that would play into that same question. Does it matter how far along I am in my pregnancy in which, I should or should not be concerned, or, is there any science on that yet?
Not really. What we know is that people, probably want to continue to talk to their doctors about going to their appointments if they are anticipating that they're going to be giving birth, and they want to make sure that they are staying up to date with any diagnostic testing that their doctors may request of them. And just communication is really valuable at this point. Keep in touch with your healthcare providers.
Someone texted this, and we talked a little bit about this when we were doing this yesterday, but are there any additional symptoms of COVID-19, including diarrhea and abdominal cramps? Are those symptoms of this virus?
Those are potential symptoms. Not everyone's going to get that. Some proportion of people do get those symptoms. Some people get a rash. Some people get headaches. Some people get muscle aches. The most common ones that we see that are being looked for example, at the screening locations include a fever of 100.4 or higher, plus either cough or shortness of breath. That seems to indicate that the infection might be a little bit worse, and so that's why they want to screen those people, but catch them before they end up in the hospital. But this is certainly something that we're observing. We're seeing that there's a lot of different ways that this virus can present, and so we'll continue to see new manifestations.
Now, when people go to the hospital or when they go to that testing line and they are checking for the fever, the cough, the shortness of breath, what do doctors do? Are they giving them prescriptions to help with those things?
It depends on the individual circumstances, what's happening. So if someone goes to a hospital, for example, someone has flu-like symptoms, they run the test for them, but they're not sick enough to stay in the hospital, they'll probably provide them with guidance about ways to control your fever using, for example, acetaminophen, which is Tylenol, or ways to control other symptoms that you're having. If you're having cough, If you require hospitalization, different pathway forward. If you're there at the test site only, then the likelihood is that they're going to give you guidance about things you can do, such as staying at home and isolating yourself, washing your hands often, using over-the-counter medications, staying hydrated, drinking plenty of fluids, general ways that one can take care of oneself, as well as giving you the warning signs. If you become short of breath, you need to do X, Y, or Z. Okay.
And are there any telltale signs that let people know, hey, I need to go to the hospital at this point?
In my personal opinion, if someone is short of breath, if you do not have a baseline shortness of breath associated with some other diagnosis, some people have heart problems or lung problems that leaves them a little short of breath already. Okay. But if you have brand new shortness of breath, then that's something worth giving consideration to. You don't want to sit there at home and not have enough oxygen. So that's worth giving a call to the emergency room or calling 911, letting them know your symptoms. They can help determine, do you need to go? If you're really feeling, hey, I need to do something now, then go ahead and get to the hospital.
Okay, so that's a good clue for people if they're at home. We've heard a lot about the different drugs that people should and should not take: vitamin C, zinc. Shouldn't take ibuprofen for this virus. Is there anything new that people need to know about that you're hearing?
Well, the guidance around ibuprofen, in one country so far, there's been specific health guidance that says, perhaps limit use of ibuprofen. Virtually no other countries have come up with that same guidance. The World Health Organization has not come up with that same guidance. Our Food and Drug Administration has not come up with that. So we don't have any specific hard evidence at this point that says don't take ibuprofen. People certainly can take acetaminophen, which has similar effects if they want to help lower their fever or help with aches and pains. That's another alternative. If people want to take a daily vitamin, or if they want to take a supplemental vitamin in moderate doses, that's reasonable. Some people online are promoting mega doses of X, Y, or Z, and that could be really harmful to someone. You don't want to, end up hurting yourself by virtue of seeking a cure for this. I understand people are uncertain, people are worried, and the best possible approach is a balanced diet, trying to stay hydrated, try to get a moderate amount of exercise to burn off stress, go for a walk, get outside a little bit, but in general, social distancing, washing hands, disinfecting your surroundings.
We had a question from someone who texted in saying, what percentage of people are actually coming off of the ventilator? Is that something that we know at this point?
We don't have a specific number for that at this point. It's variable, community by community and country by country, so we're observing this and learning more.
Okay, and as we said before, what we know right now is that there are about 100 people right now who are battling COVID who are on ventilators across the state of Louisiana.
Correct.
So unfortunately, we just don't know the answer to that yet. Another person is asking why Metairie doesn't have a testing site. Any idea why Metairie doesn't have a testing site?
To my knowledge, some of the hospital facilities are actually able to offer testing, but I do not have any specific insights as to where the different testing sites are being allocated by the public health authorities at this point.
I think there were some urgent cares that Oxnard has where you were able to get a test, and then also Oxnard has other ways to get tests in Metairie as well. So those are some possibilities there. And there's also a great resource at 211. If you call 211, there are some people who are going to answer that hotline, and they're able to give you some great guidance about where you might be able to go or not go in Metairie. That's different from those three main testing sites that we talk about a lot. Talk about that a little bit for people in case there's some confusion there about, we're talking about the Alario Center, we're talking about Armstrong Park, we're talking about out at the lakefront for the three different testing sites that are sponsored basically by the federal government, but there are other testing sites out there available as well that are run by the private hospitals. So can you talk about those a little bit and what you know?
Sure. So each of the, there are those three main sites, which are of course the drive-through sites. They open at 8 a.m. each day. They have a limited number of tests that they can offer to people who have a fever of 100.4 or higher, or cough and shortness of breath. Clinical staff on site can assess your symptoms, determine if you are appropriate for tests. The other sites, such as hospitals, I know that LCMC has a number 962-6202 for their COVID hotline. There's the 211, which offers access to a variety of different testing locations. You mentioned Oshner as an example. Each of these other locations also has been bringing online their own testing capacity. And by virtue of doing that, that means more tests can become available to more people. In general, one should call ahead. And so you can get the specific guidance about what they are looking for to be able to offer tests, to whom they're going to offer tests, what are the times that you can do it, and which locations, so that you don't end up, driving one place and then driving another place and becoming frustrated with that.
Okay, so definitely call ahead, and then you can figure out exactly where you need to go, so you're not waiting in line 3 hours and they say, sorry, we can't give you a test here.
Correct.
So that's definitely good advice. Someone texted back asking a follow-up question to the question about the flu. And when we say that it's more deadly than the flu, what does that mean? When we see a large number of flu cases and people dying?
If there are 1,000 flu cases and there are 1,000 cases of this, then there's a higher likelihood that someone is going to die if they have this than with the average influenza virus.
Talk about nursing homes a little bit. We heard from the governor earlier today that there are 2 new nursing homes that have COVID positive patients around the state. That's obviously a cause of concern. Why?
Well, we know that certainly people who are elderly have a higher risk of infection and have worse outcomes with this. And also, in living in close communities, that means that it's more likely that the virus can spread from one person to the next. So that then these communities become sort of clusters of patients, and we've seen that in our own community. We've seen that in Seattle and other places around the globe, and that's worrisome.
The governor said that he has requested epidemiologists. Did I say that right? Did I get the right?
Yeah.
Did I get the right expert? Just making sure.
Yeah.
We've mentioned so many of them in the recent days that I'm almost getting them confused. But he's requested epidemiologists from the Centers for Disease Control to come down and investigate some of those clusters. That's pretty significant too.
Right, and that's very helpful if we can get that additional expertise. We have some really top-notch epidemiologists already here in our state, at the Office of Public Health and at LSU and Tulane and elsewhere, but we can use every hand on deck at this point, and when we get these additional experts coming in from the Centers for Disease Control and Prevention, then that allows us to better track who else has been exposed and try to intercept and reduce exposures.
Has anyone been treated with hydrochloroquine yet, or chloroquine?
I'm not familiar with people being treated in our community with that. In general, it's considered what's called anecdotal evidence. It's not based on a scientific study at this point. Scientific studies have proven that it can be effective for other diseases, but we don't have the studies yet for this particular disease. So in our community, it's not something that's being actively prescribed most of the time. I do understand that there are some shortages at pharmacies now because people are very enthusiastic about getting this. I worry that we may be hoarding these medications, and the risk of that, of course, is that there are a number of diseases that are already in need of these patients with diseases that are already in need of these medications, and we may put them at risk, not permitting them to get these medications for a disease they already have.
Okay. I think there are a lot of people who are still being asked to continue working by their employers out there. We're hearing from some of them who are saying, is my job an essential service? What's the danger in that, and any advice for those people?
I believe that the mayor's office and a number of the communities, as well as the governor's office, has put out specific guidance about what constitutes an essential service. I think that one of the national chains recently, I think it was a video game rental place, was cited as asking its employees to go to work in California as if that was essential. Clearly, that's not essential in this time. We're trying to save lives. So I think that each person should really give consideration and speak to their employer if needed, or check out the guidance from the governor's office and the mayor's office to see what is identified specifically as essential. We don't want people to go out of their homes unnecessarily. We don't want people to further risk themselves. We do not want people to put their lives in danger or the lives of others in danger.
What we heard from the governor today even is, if you don't even have to go to the grocery store, hold off a couple of days. Try to make your grocery store trips once a week. Don't go to the grocery store every day unless it's something that you urgently need. So I think that's something that we're hearing across the board.
I think that's definitely true.
Some questions about how long the virus lives. This is something that affects people, especially about things that are coming into their homes, like if they're getting deliveries from restaurants, if they're getting deliveries from Amazon, if they're getting mail even. People are curious how long the virus is going to live and what they should do about it. Any advice there?
Sure. There was a recent article in the New England Journal of Medicine, a very respected medical journal, which identified the duration with which the virus can live on a variety of different surfaces. For example, copper was only about 4 hours to 8 hours. Something like cardboard was longer than that. It might be 12 to 24 hours. Plastics and glass and other metals might be 2 days or even longer. So I would encourage people, if they bring something into their home, if you don't need to use it immediately, if you don't need to open it immediately, perhaps let it sit there for 3 days. And then you can be reasonably confident that it will have no longer have active virus on it. You can also apply Lysol wipes or disinfectant spray to it. That can also be helpful. Certainly anytime you bring something into the home, wash your hands with soap and water for a minimum of 20 seconds afterwards.
Okay, so just let it chill for a while if you can.
I think that's very reasonable.
Fruits and vegetables?
I think if you don't have to eat the fruit or vegetables right then, I think letting them chill also would be reasonable. But the other option is that if it's something that you can cook, if you boil it or broil it or microwave it to a really hot temperature,
You're going to be good.
You're going to take care of it.
Okay, yeah, it's going to kill it. Another person asked the question, and I think this is top of mind for a lot of people when we talk about testing. This person texted in saying, since there's no cure and we are practicing social distancing, why does it matter if people get tested? I think that's a great question.
So in general, what we're trying to encourage is that for people who do not necessarily feel like they need to put themselves out there, if they can successfully stay at home, if they can successfully manage cold symptoms or flu symptoms, which is most of the time what this is going to present with, if it presents with any symptoms at all, then yes, you can stay at home. You don't have to, right now when we have a limited number of tests, you don't have to go out and get tested. Once testing expands and we have unlimited number of tests, it will actually be helpful to know each person who's infected, because then we can try to limit the likelihood that that person comes into contact with anyone else. And if they do come into contact with someone else, we can try to track down each of that person's contacts to try to interrupt the ongoing transmission. But for now, there's a reasonable question there. If someone is well enough to take care of themselves, if they can stay inside for 2 weeks, if they can manage their symptoms on their own, you don't have to go out and get tested. Stay home, do yourself a favor, don't expose anyone else, and that was also a favor to everyone else.
I think it's safe to say that people, some of them who are still having to work and who are still being asked to work, and even in some of those essential jobs, that they're sort of caught between a rock and a hard place. I feel like I may be coming down with something, but I don't know what it is. Do I, go to try and get a test when I don't necessarily have a high fever, but I'm feeling this cough that I'm not used to that feels different to me? It's a difficult situation. I think people really are having a hard time making that call.
Yes, people are having a hard time making that call. It's tough to weigh, the balance of what to do in these circumstances. You want to take care of yourself and your family. You need your job, you don't want to expose people, you don't want to be exposed, and this is a challenging time. And so every person needs to sort of make the best decision that they can with the information that's available to them, talk it over with their employer, with their loved ones, and make the calls that they need to make. In general, if we all focus on maximal social distancing, if we focus on hand washing, if we focus on disinfecting our surroundings, doing as the governor suggested, don't go out unnecessarily to the grocery store, make it once a week if you can make it once a week, or once every 2 weeks. Every little bit that we can do to reduce transmission will help, but people are facing difficult choices.
Something that I'm telling my family, which may or may not be right, so I'll ask you since you are the expert, is I'm getting everyone to take their shoes off before they come in my house if they've been other places, meaning if my husband goes to the grocery store or when I come home from work every night, I'm taking my shoes off before I go in the house. Does that do any good, or is it just in my head?
It's not going to hurt.
Okay.
It's not going to hurt, and certainly it's possible that you could have stepped on something which may have had virus on it. Certainly, it's not going to hurt to leave the shoes at the door.
Leave the shoes at the door. Okay, so I'm not completely crazy, but
you're not
maybe
completely
a little
crazy.
Bit. I think this is making a lot of us a little bit crazy at this point. But that is good to be better safe than sorry, right?
Absolutely.
Okay. Someone is asking about the moving around of resources and the shuffling of resources in the state, and I think there are a lot of questions about whether or not that's happening. We're hearing from federal officials, FEMA included, last night talking about how they're assessing what our resources are in this country, and I think the question is the governor and are we looking at how many ventilators do we have? Where are they? A lot of surgical centers have ventilators that may or may not be being used for elective procedures. The governor has asked for those to stop at the moment. Are we looking at those resources and saying where can we allocate people if we need to?
Yes, and the public health authorities definitely are looking for those resources. The governor's office is definitely looking at those resources. We also know that they're looking at alternative options. If we run out of hospital beds, they're exploring, okay, can we place people in hotels? Can we place with medical attention, obviously? Can we place people in other places? There are a variety of different steps that the governor and the public health authorities are exploring together with FEMA and federal partners to ensure that we're going to have some surge capacity. We can't invent or pull out of thin air ventilators or personal protective equipment like masks. So that's an area that we're giving consideration to, we're worried about to some extent, much as the rest of the country is. But certainly the planning is in place. We're developing new plans daily. The situation is still fluid. And the authorities are making every single effort to try to anticipate what are the next 3 steps that we're going to need.
Okay. When we look at Italy, what are we learning from Italy as they are in over their heads right now in some places?
Social distancing is the most effective means to prevent us from becoming Italy. So they took longer than they would have wished in many instances to get people to stay home, and now they're seeing the consequences, unfortunately, and we're certainly keeping them in our prayers. They're struggling really hard. We know that it's important as well for us to think about if we have opportunities to generate new or manufacture new N95 masks so that we can protect first responders and healthcare providers and people who work in nursing homes and the like, that's really critical. So I know that many of the local hospitals and the state are reaching out outside of state, outside of the country to try to import these critical personal protective equipment devices. But the story in Italy is one that we don't want to repeat.
For sure. I just got a text from someone who said she was at the hospital for 3 days with her husband for surgery. She's now running a low-grade temperature. I don't want to get tested to waste a test for others who may need it. If this is the virus, treating symptoms at home myself, how do I know if I'm no longer carrying the virus, if I'm feeling better, and should I get tested?
Stay home if you are well enough to take care of yourself, if you are able to restrict going outside and moving into contact with others, stay home for 2 weeks. If your symptoms have resolved for at least a few days after 2 weeks, then theoretically, you most likely are going to be in the clear. If you start to get worse, of course, if something else develops and you're worried about it, then seek testing.
Okay. This is a question that's on all of our minds, I think, and it is, could someone who was tested positive for the virus after that 14-day quarantine get it again?
We don't know the answer to that question yet. We don't have enough experience with the virus to know whether people can become infected a second time. So we're hoping that some immunity builds up. We're not confident of the level of immunity that may be possible, and so that's an important question that we are looking for answers for.
Another person asked, just for your medical perspective, do you see us on house, lockdown for another 3 weeks?
I think it's very reasonable to anticipate that if the governor says that we're going to peak, sometime on or after early April, that means that we're going to continue to see a high level of cases in our community for a longer period of time after that. Some of the projections that have been published in, even public media, not necessarily even medical journals, suggest things like May or June for peaks. So let's, take a deep breath, recognize that we're in for a little bit of a marathon here. This isn't a sprint. I think that, any suggestion that getting back to business, by next week or the following week is probably premature.
Okay. I think a lot of the questions that I'm getting here are people with chronic health conditions, and people are concerned about that. It's very top of mind, and they're concerned what's going to happen or what could happen if they do get the virus and whether or not they need to get tested. So can you talk about what some of those chronic conditions are that people need to be a little bit more aware of themselves and their family members who may be dealing with them?
Sure. Virtually every condition for which you receive regular medical attention and have ongoing medication, for example, is something that potentially could put you at higher risk for contracting this virus or having a worse outcome. So many of the things that we see in our community include things like chronic obstructive pulmonary disease, COPD, or heart disease, or kidney disease or high blood pressure or diabetes or asthma. These are common conditions. Many people have them. They are likely to be at higher risk of contracting the virus or having a worse outcome if they do contract it as a result of these chronic conditions. So this is another reason that it's really important for each of us to take responsibility, try to stay home. You don't want to infect someone else. You don't want to become infected yourself. And take every opportunity to try to wash your hands and disinfect surfaces that you touch commonly, things like door handles, the refrigerator door, faucets, things like that. Let's make sure that we're eliminating the virus on those commonly touched surfaces.
Now, someone, on that note, on the cleaning note, someone asked the question about cleaning products that are running out. And of course, anyone who's gone to the store in the last 3 weeks realizes that the bleach aisle, that the wipes aisle, a lot of those aisles have been empty, and it's very difficult to find some of those cleaning products. Is there anything else that people can use at home to disinfect surfaces that will kill this virus other than, bleach wipes and what people typically think is a cleaning product?
Ethyl alcohol. So if you use alcohol in a 70% or higher solution, that can be something that can be effective. We know that if you have, say, many people, might not be able to purchase Clorox wipes, but you might have a gallon of bleach somewhere, and I'm not suggesting, that you use the direct bleach, but you can take 1/3 of a cup of bleach into a gallon of water, and that makes a very effective cleaning solution that kills the virus. So there are some additional things out there. One can go to the cdc.gov website and look under the COVID-19 page, and there are a lot of disinfectants that one can find there. There's now hundreds that have been identified, some of which include household items that might already be available that you might have at home. And many of the cleaning supplies that we might not have thought of may also be on there. So go ahead and check that list out.
Okay,
these are
that's
approved by the EPA as well.
Oh, that's fantastic. Things probably like 409 cleaner and things like that. I don't know if that's one of them, but it's worth checking.
Definitely worth checking out. Literally there are hundreds of them now.
Okay, that's great. We are getting some more texts from people. A woman who just texted in saying she's got 6-month-old triplets that are preemies. She shut her house down to everybody, has canceled appointments. Are they at the same level as older people or people who are elderly with chronic conditions? Are they at the same risk of getting the virus and getting a serious case?
We know that premature infants as well as newborn infants are still developing their immune system. So we should anticipate that there's probably some degree of higher risk. They definitely should continue to restrict access to their home and limit contact with other people to reduce the likelihood of exposure. Stay in close contact with your pediatrician if you come up with, if there are new symptoms which develop, for which you're, have some worry. Having that helpful conversation with your pediatrician or your child's doctor is going to be, a voice of reassurance and a voice that you can trust. So I would encourage that as well. But these younger babies, they do have still developing immune systems, so we can anticipate that they are a group that does need to be protected.
I think a lot of people out there are just wondering when it's all going to end. And we're hearing from people, through those text messages. 529-4444 is the number to text if you want to ask your question to Dr. Springgate. But, is this going to last till July or August? We just heard from someone.
I think that we can anticipate, based on the models that I've seen, the projections I've seen, some of which have been, published in, common media as well. We can anticipate, or media like New York Times or other national media, we can anticipate that there's going to be an initial big wave of cases, and that may go into the summer. And then we can anticipate after that there may be several smaller waves that will continue to come back, right? And so eventually we're going to get that herd immunity that we talked about, we hope, assuming that we do develop some immunity to this. And that will help us. And then eventually also the projections are 18 months from now, fingers crossed, we're going to have an immunization, which will also help. But this isn't going away quickly. And we can anticipate that, there are going to be more difficult times ahead, particularly in the coming weeks. And then even after the coming weeks, it's going to take a longer period of time for us to sort of weather this storm. We have to be there for one another. We have to be there for our friends and loved ones. We have to be there for each other as a community. And we have to really make every single effort to try to heed the public health warnings and practice social distancing.
I know people here in the New Orleans area are used to dealing with hurricanes. We're used to running out and getting supplies we're used to stocking up on things that we need that are going to take us through a couple of weeks. And I think that's a lot of what we saw when this initially started to trickle our way. And now people are at that mark where it's been, a couple of weeks of hearing about this, and it's not ending. And so people are saying, well, what now?
Right. And I think that, we are going to see some relief coming from the federal stimulus package when that passes Congress, which apparently is going to be soon. That's going to provide some paychecks to people who may have lost their jobs or be at risk of losing their jobs. And, enhance unemployment insurance. These types of things are going to be valuable for our community as well as for communities around the country. We also, have new innovations that people are coming up with, which are going to be helpful. I was listening to WWL radio earlier today, and there was a terrific story about a group that's bringing together different restaurants to try to provide food to people who need it. I think that there's going to be a number of different ways that we can repurpose our workforces, so that people can get jobs and can get paychecks, but also provide needed resources to the community. There are things that we can look forward to which are going to bring some hope. It's going to be a longer haul than any of us are comfortable with. And, we don't want it to be that way, but if we're faced with that, we are strong, we are resilient, we're going to make it through.
Talk about the restaurants and that part of this and ordering food from restaurants. Should we be concerned about those packages that we pick up from restaurants and the food that we are getting from restaurants? I know it's top of mind for a lot of people.
I think that there's an opportunity there, when in our discussions this morning on the morning news, we saw evidence that people are ordering from restaurants. The restaurant meets you at your car. They're wearing gloves. They take your credit card. They use a wipe on it to sanitize your credit card. They run it. They hand it back to you. They sanitize the pen, hand it to you, get it back, sanitize it again. The food is in containers that's been heated to the appropriate temperature to try to kill the virus. So long as everyone involved is if you don't want to go there if you're sick, and if the people who work in the restaurants don't want to come to work sick, if everyone's doing their part to stay home if they're sick, if they're showing any symptoms, and to minimize social contacts that may be unnecessary, that can be a great way not only to get out of the house, get some food, provide nourishment for your family, also to support our local businesses, support those people who need those jobs.
Somebody asked, are you ordering out?
I took advantage of the opportunity to order some delivery crawfish the other day from my friends at Nola Boyles. It was awesome. And so I really want to encourage people, think about your neighbors in your community who are running, terrific restaurants right now. I know some of the higher end restaurants are offering takeout services that have never done that before, places like Lillette uptown. And there are some, places that otherwise would offer delivery services. Eric was talking this morning that he went to I think, Zia in Metairie. There's a variety of different opportunities out there. And we can really all support our community and support our small businesses, support the restaurant workers and the hospitality workers who need these jobs, and also give ourselves a chance to get out of the house a little bit and eat something that's not beans and rice.
Right, absolutely. This is a question about transmission and testing and that uncertainty of people not knowing whether or not to get tested, not knowing if they need to stay home and what the situation is. I mean, everyone is supposed to be staying home, but those who have to go out and who have to go to work and they're in essential jobs. But if your spouse has come in contact with someone who's been tested for the virus but still doesn't have the results, and that person's getting better, and both of those people who came in contact with that person who's been tested are experiencing no symptoms, should they stay isolated?
I think at this time, we probably have to assume that all of us has been exposed. That's the baseline way to approach this. That was the governor's advice, which I think is very good advice. Assume each of us already is potentially contagious. So you want to minimize your unnecessary social contacts. If you have active symptoms or a positive test, put yourself into that isolation group or that self-quarantine group. If you do not have active symptoms and you do not have clear evidence that you've been in touch with someone who has a positive test, then just try to practice general social distancing, wash your hands, disinfect surfaces.
Okay. We've also heard from the NBA player who tested positive recently that he has lost his sense of smell and taste. And that's something that you may or may not have heard is actually one of the consequences of getting this virus. Can you talk about that a little bit and whether or not that's permanent, what people can expect, and why it happens?
Right. It appears, this has also been reported by a group of ear, nose, and throat doctors out of England, as well as some other countries have made observations like this. It can happen whether someone has other symptoms or not, but if you suddenly, in this new environment, do develop a loss of the sense of smell or a loss of your sense of taste, that may be an indication that you may have been exposed to the virus, you may have contracted the virus. We don't know, we don't anticipate that it's something that's going to be permanent. There are times with other infections or other health concerns that people can temporarily lose these senses and then they will come back again. But it can be an early warning sign and something that might be helpful for people.
Okay. Do you think that's something that happens on the front end of it or something that happens on the back end of it?
I think it can be variable. So some people may have no other symptoms but that, so in which case it might tip them off. But some people may be, pretty poorly off and also have that.
Okay, I gotcha. Lots of questions about the throat and the fact that we're hearing about the throat and its role in all of this. Some people just texted in asking if you drink hot and warm things, can that help you minimize the virus's impact on you if you do have that sort of sore throat infection?
No.
No.
Drinking hot and warm things, while it may be comforting to your throat, it may help you feel a little bit better, does not have any impact on the growth of the virus, the transmission of the virus, or anything like that.
Okay, so it's not necessarily going to help you kick it.
Correct.
Okay. Why are the coronavirus tests taking so long to come back? Why is it taking several days in some cases? I know some places it's taking a lot less than that. Some places 45 minutes now, or?
Right. There are a variety of different types of tests which have been manufactured. You can imagine, think of it like the production of automobiles in the United States in the 20th century. In the beginning, there was a Model T.
And that was it.
And the Model T, chugged along and didn't go too fast. It was pretty amazing, but it wasn't going to get you, from here to Ohio in 6 hours, last year or the year before, recently you come out with, super fast Teslas that can go 0 to 60 in 2 seconds. So we're seeing a lot of these innovations come to market simultaneously. Now we need to get more manufacturing of these different types of testing supplies and testing kits, and we need to get them distributed to as many of the different locations around the country as need them. So that takes time.
Okay. We heard the president in the coronavirus task force yesterday. They were talking about the possibility of self-swabs. How far along are we in that possible process where you could get a swab, take the swab in the solution, hand it off to a healthcare worker instead of having them swab you?
The theoretical application is already possible. We just need to get to the point where companies can manufacture it and it can be distributed. It's not a question of is the science there to do it. The science is there to do it. It just has to be done in a safe way so that we don't put the people at risk of spilling the reagents or the chemicals onto their neighbor somehow and getting their neighbor infected or otherwise.
I have to interrupt you real quick. President Trump is about to speak.